This segment sponsored by Viking Psychiatry. I am at Viking Psychiatry, which offers a dynamic approach and innovation to interventional psychiatry. And today I'm going to learn all about their approach to treating suicide and depression. Let's do it. And I am joined by Sean Goddard, who is the owner here at Viking Psychiatry. Hello again.
So good to see you again.
You too. Okay, so we are learning so much by talking with you about your practice, but really about this mental health issue that people are dealing with and solutions that you are providing here to our community, which is so great. And so, of course, we've been getting to know you over the last couple of weeks, but in case this is someone's first time seeing it, what is Viking Psychiatry?
Viking Psychiatry is what we call an interventional psychiatry practice, which is just a fancy way of saying we want to offer tools and treatments that people can't get elsewhere that make a significant impact, right? We don't offer just another pill here. And we offer a warm environment for people to come in and get some care and feel comfortable while they're doing it.
Right, yeah. And I know last week we talked about deep TMS and that treatment, and today we're going to talk about Spravato. And so tell me, what is Spravato?
So Spravato is what's generic name is esketamine. It's intranasal esketamine. And it's a treatment that has been created from ketamine, which is a drug that we often see used in anesthesia. And it's been around for a long time, ketamine, and they realized that it can have an effect on mental health. And so it's approved to treat treatment-resistant depression and acute suicidality. Wow,
that's really intense. It's really good because I know that those types of disorders are intense and they need quick help. And I know that you're aiming to be such a quick turnaround for patients that come here. So talk to me about that and how you want to be a quick solution.
Yeah, absolutely. When it comes to medications, most of them, when we start a client on a new medication, you know, we tell them 8 to 12 weeks to begin to see a difference. And that's to begin to see a difference, right? And there's not a high success rate with those oral medications. And so when somebody has failed 2, 3, 4, 5, 6, plus medications, and you come here for treatment, you want to feel better quick, right? And typically that's not seen in mental health. But with Spravato, we can see differences in as soon as the first treatment. We see significant impact on depression, on suicidality, and I mean, this spray is so amazing that within 4 hours of your initial treatment, you have what are called brand new dendrites being formed in your brain, and so you have new communication occurring, and communication is vital when it comes to feeling better.
Yeah, that's so cool. And really, I know that this facility offers a lot of accessibility for this treatment. You have how many rooms, how many treatment rooms?
Yeah, so right now we have the capability to treat up to 14 people at a time. And we do 3 treatments a day, 3 rounds of treatment on Monday, Tuesday, Wednesday, and Thursday. And our goal was, when we first started, we only had 4 chairs, right? And what we didn't want is a waiting list and people having to wait for treatment. So we've gone extra steps to try to make sure that we can add as many chairs as possible, so when somebody needs help, they can get it. Our goal is, if somebody's acutely suicidal, we see them within 48 business hours, and with treatment-resistant depression, we see them within 7 to 10 days, so that people can get that treatment going right away. Because when you have hope and you take that first step, right, you don't want to have to then wait 4, 6, 8, 12 weeks to get in and be seen.
Yeah, I find that so interesting. I'd love to talk a little bit more about that. Traditional treatment takes so long, and so I almost want to say, why is that? Because when people need help, they need help now. And it's such a sensitive topic and a sensitive area that people have to deal with. Why should they wait? That has consequences.
Yeah, I liken medications for depression kind of like walking up a hill or a mountain, right?
Yeah.
When you first start out on that hike, you've got all that extra energy, right?
Yeah.
And so you kind of put something into it. And when we start a new medication, often we feel that initial little bit of a difference or that change, right? But the longer you're hiking that mountain, the slower your pace gets, right? And it takes a while to reach the peak of that mountain, right? And it can become exhausting, and people quit and they say, forget it, it's not worth it. I'm sweating too much, my muscles muscles are aching too much, right? So side effects from the medication. And they say, forget it, it's not worth it. I don't even want to see the top of the mountain anymore, right? And so our goal is with Spravato, we're going to put them on the chairlift and send them to the top of the mountain as quickly as possible so they can see the view and get a difference immediately, right? And then they'll have the energy and the motivation to go hiking on their own.
Keep going. That was a great example. Yeah, great visual there. Okay, so this is the room, one of the rooms at least, in the special chair, and we have someone that you're going to demonstrate.
Yeah, Holly, she's on our staff, and she's agreed to be the guinea pig in this case. If you want to go ahead and have a seat, Holly.
Please.
And so when people come in for treatment, normally actually this room is dark, and we have nebula lights going on, right? Our goal is to create a relaxing environment. The nebula lights just kind of help people kind of get lost in their thoughts, right? And so with Spravato, the standard treatment is you come in for depression, for example, twice a week for 4 weeks, once a week for 4 weeks, and then once every other week for 4 weeks. And a significant portion of people are done with treatment at that time. Some people have to continue on, depending on what's going on, the severity, or they did amazing and they want to continue to stay in that range. So. But when people come in, they're here for about 2 hours because this is what's called a REMS controlled medication. And so we have to report vital signs within 7 days of treatment to show that people are responding well. So it's got strong safety data behind it, 6+ years of data that shows us it's safe not only for initial treatment, but even longer term treatment. And so they come in, and in the box, we have 3 devices, 2 or 3 devices depending on the dose that look like this. And so what folks are going to do is they're going to just spray this themselves into their nostril, right? And so Miss Holly here will give us an example. Staff will be in the room with them. We give the doses and guide the timing. And so they'll take the first spray and insert and spray into the nose, and they'll immediately spray into the other nostril. And then Miss Holly's doing a great job in keeping her head straight, right? Because we want as much of that to stay in the nasal cavity as possible. And so we'll start a timer, and then 5 minutes later, they get their second dose, right? And so that's the 56 milligram dose. And then if they're getting the highest dose, 84 milligrams, 5 minutes after that spray, we'll give them a third one of these, right? And the milligram is really dependent upon a couple things. One, we always start with 56, the lower dose, in some populations, even maybe just one sprayer. And then we assess their response to determine whether or not we need to go to the higher dose. Not everybody does, right? And we have that flexibility that if the higher doses may be too much, right, as they begin to respond, then we can always back them down to 56. The goal is that they get their treatment, complete it, and get all the way through. So we're going to do anything we can to make that possible.
Wow. And then after, so you say it's a 2-hour time frame, but once they get the nasal injections, how long do they sit here and kind of let the medicine take place?
Yep, so the nasal sprays, all in all, you're here for about 2 hours. So when you come in, we get your initial set of vitals. We come in and we do your sprays. And then at the 40-minute mark, that's where we can see blood pressure creep up a little bit. So we want to make sure that your blood pressure is doing okay and you're doing okay. We'll come in at 40 minutes and recheck your vitals. And then you just kind of hang out again till that 2-hour mark. And then after 2 hours, you're going to be free to go. Now, this is kind of like surgery, right? They wouldn't give you anesthesia and then let you drive yourself home, right? And so remember, esketamine is half of ketamine, which is anesthesia. And so people can still be a little bit sedated, or what I joke around and call drunk walking, right? And so we definitely don't want them getting behind the wheel. And so they do have to have somebody to drive them home, whether that's a friend, family member, or even Uber or Lyft or something like that is possible. But you can't get on your bike or your car or anything like that and take yourself home. And we support them. We create a comfortable environment. We have fans, we have neck cooling fans, heating apparatus for the people that want to really control their temperature. We have a call light system that goes to them with no sound, so staff know to come help and assist. And
you have snacks.
Well, yep, we have Jolly Ranchers and Starbursts, and the reason why is some of this can sometimes drip down the back of the throat, and I've been told it's not the best tasting stuff in the world, so we have candies to help people be able to get rid of that taste.
That is so awesome. Well, that's so great that you're offering this, and that was great to learn more about it, so thank you. If someone is interested in looking into this treatment and learning more from you, where should they go?
They can go to vikingpsychiatry.com or vikingpsych.net to make it easy. And they're also welcome anytime during our business hours. They're welcome to stop in, get a free warm cookie, and one of our staff will make themselves available to talk to them a little bit and see about getting them set up for an appointment.
All right, Perfect. Thank you so much,
Thanks.
Sean.
Appreciate you coming by.
And if you would like more information about Viking Psychiatry, we'll have their website listed below, and I'll see you after the break. This segment sponsored by Viking Psychiatry.